Going live now. And I guess we are. The button came on. We are live. That's amazing.
Surprise!
Surprise! It's a surprise. we're actually got the technology to function right here at the beginning. So, welcome to everybody that's in the audience. We've got quite a group coming in. Can those who are out there just send a message in the chat box that you actually see the presentation, that we're actually live? Send us a message so that we know that you see what we're seeing. And we'll wait and see if anybody responds to that. It's a great thing that is happening right now. But are we actually live? Marcia's there. This is good. So, yeah, I guess it just takes time for everything to get into sync, because I see people writing some comments. And this is great. Hi, Eric. This is good. We actually get to walk through the process and chat with people. This is a conversation today. It's not a formal presentation. And I've got a couple of guests, as you can see in the film strip below the screen, that I'll be introducing and bringing live shortly. All new technology to two of us, and we have one expert with us today to bail us out should anything happen. But really great. Look at this. We've got comments going back and forth, and it's nice because the comment system is such that we can actually highlight a comment and bring it right there on the screen. And let's see if I can bring something up here. Hey, there we go. Comment actually shows up. This is really good. So as the comments move, I'm so excited by the technology. As people who know me, and just about everybody who in the audience knows me, has some background with me. There are a few brand new people who are getting their first chance at seeing what kind of nerd I really am. But the technology seems to be working, so we can get in. And it's kind of exciting because for me, it's not just a conversation with some friends and a wonderful supportive audience. This is something that I wanted to do while I was in my cancer treatment program. In fact, it was one of the things that kept me sane, was thinking, you know, what it was that I was going to do with my life after I survived cancer. And I've been talking about this for a couple of years now. And finally, today, we're actually launching our webcast on Find Your New Normal and getting out the first message to people, because there are so many messages in my head that I wanted to bring to cancer patients and caregivers and healthcare professionals. And hopefully, if we survive today and this works as well as I'm hoping it will, we'll do this on a regular basis. There's some interesting new concepts that I'd like everyone to hear and talk about and see where it can go. So thank you all for attending the inaugural launch. This is quite a moment of excitement. And to share that excitement with me, I know you can see down in the film strip to the left of me is Sheila Shuster. She's going to be our formal guest. You can just wave there because I think they can see you. Yes, I can see you, so hopefully they can see you. And beside Sheila is a good friend of mine, Michael Daniels, who's really involved in a caregiving facility with an aunt who is dealing and coping well with cancer. And on top of it all, he understands this technology and volunteered to be there in case we had problems and to do what they call comment wrangling, because the comments are over on the side for me and I really can't see them that clearly. But Michael promised that he would look at it, and if there's something that you out there in the audience want to share, Yeah, he'll highlight it, we'll bring it back up onto the screen and talk about it, just to keep the flow going, because that's what I really see this 30-minute period being. It's just a light, casual conversation about coping with cancer from a non-medical perspective. How do you deal with this emotional roller coaster? What are some of the things that you've got to be aware of? And that's a good segue to start the introduction to Sheila, because she is a very, very close friend of mine who is not only just a nice person, she's a very practiced person in helping people deal with change in their lives, dealing with tragic loss, and she has developed some really profound skills to help people cope with the changes that happen to you as you go on a journey, particularly the journey we're talking about today with cancer. She has some practical experience and some really interesting knowledge to share with us, and certainly on a personal note helped me as I was finding my new normal on my recovery process. I was quite amazed that she would talk to me. I saw one of her videos and said, man, it'd be really nice if Sheila would open up and allow me to make a contact with her, and she did, and it's just been it's such an enjoyable, profound relationship that we've created. So let me throw it over to you, Sheila, and let you introduce yourself more formally. And there, I just switched the camera, and now you're on the stream, and hopefully people can see you. Thank you for being here.
Thank you so much, Dave. This is kind of fun having other people in our conversation, isn't it?
Yes, so unusual.
It is different, and I'm trying to think. It's been about a year that we started talking.
Over that now, yeah.
So I was trying to think of a way that I could introduce myself and how my perspective might be different than other people's as it pertains to cancer. And I've come up with a little scenario. So if you'll just bear with me for just a minute. Imagine a big kitchen, and in the center of this huge kitchen is a sink. And the first person to walk into this kitchen is a doctor. And that doctor has just received the test results from one of his patients and sees that that patient has cancer. Now he walks into this kitchen and stands next to that sink. And his concerns start to go up. What am I going to do for this patient? And as it does, the faucet in the sink starts trickling. And he starts wondering what he's going to do and how he's going to help this patient. And he may have known this patient for a long time, and it may have come up as a surprise. So as his concerns escalate and as he's trying to think what he can do, the faucet starts dripping more and more and more. And pretty soon it's dripping so much that it's not draining. It's coming up out of the sink and onto the floor. So he runs and gets a mop. And he's mopping up the floor with his concerns over what he's going to do for this cancer patient. And his ideas, of course, are very logical for a doctor. He's going to do extra tests. He's going to have definitive results, maybe come up with some different kinds of treatments, medications, surgical procedures, and he's mopping and mopping and mopping. Next into the room comes the patient. The patient has just gotten the news. And the patient sees the doctor ordering tests, ordering procedures, not knowing what this all means. And the patient starts his or her own concerns at that same time. And they run and get their mop, and they're mopping up the floor. And their concerns are, what's happening? How did this possibly happen to me? Where am I going to go with this? How am I going to tell my friends? How is my family going to react? What does this mean for my financial future? And what is this cancer thing anyway? I better get on Google and start looking this all up and understanding the vernacular because I just don't get it. Those two people are in the room, and finally the last person is introduced, and it's the caregiver. The caregiver comes in a little bit late to the party, and he sees the nurses and doctors and the patient all scrambling around doing their own mopping to clean up the mess of this cancer. And the caregiver has his own set of concerns. What if I do it wrong? What if I don't know what to say? What if I'm tired? How am I going to do this? How am I going to give and help someone else and still maintain my own life? So they're mopping with those concerns. Now, I don't know what to do about the medical system. I can't change that today. I cannot change the way the doctors do their mopping, but I can help patients and caregivers today to stop mopping and just to turn off the faucet. Because that's the real problem, is we're so focused on the fears around this cancer thing that I believe it's not really the cancer that causes the chaos, it's the moppers. So that's where I come in.
That's a great perspective to open up our conversation, because there's so many things that happen as the journey with cancer begins. And you're so right. The patient has one perspective, the healthcare professionals a different one, and the caregivers a totally different one. And the lack of coordination between what's really happening in the heads of these three people is quite astonishing. I know when I began the process, as you say, the fear was there, the anger was there, and it became quite frustrating because the information that I wanted wasn't coming from the medical team, and the caregiver was as much out of the water as I was. This was the first experience to it, and didn't know what to do. And everyone just sitting around with their mop, trying to clean up the mess and trying to deal with this thing, and yet everyone doing it in entirely different ways that causes great anxiety for all three groups.
Exactly.
You've worked with all three. Is that generally what you've seen? It's certainly with the people that I've met, and I should set that as a preamble, is that my perspective is not just Dave's perspective, having gone through cancer. Unfortunately, about 70% of 18-month treatment program, I was in hospital, and met many different kinds of people and talked to them openly about what they were feeling and where they were going. And in my limited space of people that I met, they all seemed to agree with me that this confusion created more stress, more anxiety. And we needed a Sheila Shuster in the group.
Well, it's an interesting thing because there is a disconnect. We don't understand what the perspective is of everybody else in that scenario. And really, there's nothing we can do to change their perspective. All we can do is come up with ways that we can address our own fears and our own concerns, because the things that are coming up for us that are making that faucet happen and the flood to occur are actually diminishing our health. So how can we, the patient and the caregiver really need to find a way to calm themselves down so they can think more clearly and are more receptive to really seeing what the other person is going through. It's the typical fight or flight syndrome that when your blood pressure is up and your heart is pounding and the hormones are being released in that state of frenzy, that you can't think clearly. So this is an opportunity to learn some techniques that calm you down, keep you in the present moment, and give you the best opportunity for you to not only feel good, but actually heal. So it's up to you. You have to look inside and find ways to address how you're dealing with it instead of being angry at the other people. It's very common. It's very easy to do. I've been on lots of sides of this, and I think I have a pretty good perspective from all three angles. And like I said, there's nothing we can do today to change the medical system, and all we can really do is change how we're reacting to this very frightening, very unfamiliar territory of cancer.
Yeah, I think the fear issue is something that is confusing, because often the medical team and the caregiver simply say, well, of course the person's afraid. This is an illness, there's a consequence, there's all kinds of interventions that are going to happen. And so the process begins almost very simplistically. And that's what surprised me, is at the beginning it was, okay, what the heck is wrong? But, oh, these wonderful people with white coats and years of training are going to jump in and save the day.
Right.
So it'll be just great for them to work through this. Unfortunately, what I discovered is that fear shifted away from fear of the cancer to more fear of my life and its future, because suddenly the big questions started to come up as to what the heck is going to be the end game here. Am I going to die? You know, this wasn't, you know, a broken arm or an illness that could be repaired. This was a life and death thing that I suddenly had to recognize. And as I questioned, will I live or die, and asked that to the medical professional, they couldn't give me an answer. And even if they could, they wouldn't give the answer.
Right.
And so I ended up with a big question mark. And unfortunately, for months and months and months, from the diagnosis period until the surgery was 7 months. And during that period, it was like the sword of Damocles that was over my head, waiting for what I hope would be life-saving surgery. And so in that period, the panic attacks just kept coming as you started to question, am I going to live? And if I do, what does that really mean? What is my life going to be like? Because the interesting dimension that confused me is I suddenly was surrounded by other people who were going through cancer, and they were not a happy camping group. There was a lot of pain. There was people that I met who died during the period that I was there. The chemo and radiation that I had to go through put me in waiting rooms of other people who were suffering. And it sort of painted a picture in my head of, oh my goodness, is that what my life is going to be like? You know, am I going to have to deal with this for the rest of my life with no quality of life as I used to have? And someone please give me some answers so that I could feel something about what the next stage of this journey was going to be. Because it wasn't, oh, you're going to get repaired and you'll move on with your life. It was something quite different. Have you heard that from the people you've worked with?
Oh my gosh, yes. Yeah, and everybody wants the answer, right? But nobody can give that to you. So we have this illusion that the doctors know everything and they have a really good idea of what's going to happen. They have experiential evidence of what's happened, and they have a sense of what may or may go wrong. But the great thing about this is when you start really trusting yourself and taking back the power to know that you understand your body, believe it or not, you understand your body better than anybody outside of you. And when you can let the doctors do their thing and give them some trust, but understand that no matter what you're going through, and I've seen it, I have seen patients in tremendous states of pain who aren't nearly as stressed as some of the ones who are going in a remission period. They're just so stressed out. They're recreating these cancer cells and growing some things inside them that they don't want to have happen. But there is this grace, there is this way to move through with this disease and do it in a way that is beneficial to you and helping the healing process. And that's what I am so passionate about, because I know it works. I've seen it work. I use it in my everyday life outside of cancer, but it is fundamental that you learn these basics so that you can take back some of that power that you have.
It's a very interesting set of conditions that the three different groups of people have to deal with. And today we've got some interesting comments coming in from the audience, which would be a good point to bring a couple of them up. Oh, look at this. My nerdiness comes up. Look at that. You can just see the question right there on the screen. So do we have to focus on empowering patients and caregivers? How to cope? And you know, how do we empower them to advocate with healthcare professionals? That's such an important point that Alan is bringing up, because the empowerment and the advocacy that I didn't understand became an essential part of the healing process. The disconnect, I really at the beginning thought I would just be in the hands of the experts and everything would be fine. And then I learned that they had only a treatment program perspective, and they really didn't have answers to my emotional issue.
Right.
Because I was starting to metamorphosize into something else. It was quite profound for me, because being a type A personality, a controller, someone really wanting to know what was going on and take charge. My life philosophy was, if it's going to be, it's up to me. And suddenly I couldn't do any of that and became a helpless invalid at times, totally dependent on other people, not just for medical care, but even to change my diapers. I had lost all my strength. I had dropped from 216 pounds to 142 pounds, and didn't even recognize myself in the mirror. And so my identity started to disappear. Who I was, what could I do? And when I brought this question of, how do I find a new normal? How do I recreate Dave again during the treatment process? We're not talking about surviving, but just in the treatment process, the team wasn't aware of what to say and do, other than, hey, if you're stressed out, why don't you see the support team that we have? See the social workers, see the psychologist, and release your feelings, get them out, and they'll help you. I followed that advice, but was frankly disturbed by the lack of help that I got. I had some nice people who would listen, but didn't have much to help me. And it was only, as you just said, when I became an advocate of my future and started to learn what I could take control of again and introduce that back to the medical team around me, and surprise the heck out of them, because as those that know me, I talk a lot, and I started to get away from, I'm the sick soul that please take care of me, to, hey, I want to be in control, this isn't right, this is something I need to know more about. Got myself, frankly, into a lot of trouble with some of the medical people. On my chart, you can still go back and see that I was labeled as Mr. Trouble.
I like that.
Yeah, well, yeah, it was, I mean, because they had big charts that said, be empowered, be an advocate for yourself, write a list of questions so that when you meet your medical team, they will answer them. And when I approached my GI expert at the time, he said, oh, I'm glad you got a list of questions. How many do you have? And I said, I have 7. And he says, I've only got time for 3. That's all you're going to get to be dealt that are going to be dealt with today. And that really that created a lot of anxiety for me. And I thought, well, I said, okay, then maybe tomorrow we can get to the other. And he says, it was almost, no, this is your chance to ask the questions. And it's almost as if I like your questions, I'll respond to them. So I became, in fact, even the nurses, when they would walk into the room, they were joking. They would say, so how is Mr. Trouble today? Because I actually canceled an operation because they didn't give me the information that I wanted. And heaven forbid you don't do that. I mean, that the world just collapsed when I did that, and it caused a lot of ramifications. But thank goodness for essentially the hospital chaplain who was there, and I reached out beyond the social workers and the psychological world to someone that I thought might have a different perspective, and she was just amazing. She really had both words of advice and also joined my advocacy team and brought me in front of the surgical people that I was having difficulty with, so we could work it out. So I think you're right. There's a change that you had to go through as you acknowledge that who I was disappearing and a new Dave was emerging, and I had to snap new life Lego blocks together in a new way that I wasn't comfortable with. But once I did that, I became more empowered, more in control, and could talk about that.
But I'll tell you what, Dave, because I've seen a change in you, and I didn't know pre-cancer Dave, so I should let everybody know that. I never knew pre-cancer Dave.
BC, before cancer.
BC, okay, BC Dave.
BC.
And the thing that I've noticed is it's not just becoming empowered and an advocate, because that also can lead you down the road of going from your head, of fighting for yourself. But you did something before that, and you didn't mention that, because you got to a place where you were very calm before you became the advocate. So it wasn't that you were just irritated and then you were the, the person who was always digging. I saw this change in you where you were at peace with what was going on, and it had to do with how you looked at today. And you could talk about that and how that felt for you, but you made a switch. You definitely in the last year have made a big change in how you look at your day. You do not worry as much. And if you're still worried about tomorrow and you're an advocate, you're sending that same nervous energy out there, which is still detrimental, even though you're empowered and you're an advocate for your own health. You have to start with this base of finding a way to be calm and still so that you can hear the answers that are really best for you, not necessarily what your head thinks is best for you. Does that make sense?
Yeah, you're dead on, because the process is a journey of phases as you go through, because you're sitting there trying to figure out what should I do and how will I actually have a life, because certainly in my case, after the surgery, it was obvious I had now a second chance to live, and that was confusing even in itself. So what does that mean to me? What kind of life am I going to have? It was like suddenly being 18 again and saying, okay, when I grow up, what am I going to do? What's my life going to be like? And it was now a rebuilding, and in that process was where you and I met, that it became clear that I needed a new approach to dealing with this cacophony of information and thought process, because the brain definitely was taking me onto a lot of different directions. And when it was in those states of anxiety and panic, you don't problem solve well, you don't have any solutions, you can't enact anything. It was learning that finding a way to get into a state of peace and calm was essential. And yet people told me that. My primary caregiver was my son, who really saved the day a number of times for me, because he would be there at 2 o'clock in the morning in the hospital in my panic call for help, and he would say, what are you doing? You're talking about things you have no control of, can't do anything about, that are just creating a set of anxiety. Can't you bring it back to things that you can have some impact on and feel better about, so that you can be calm and still? I mean, I was amazed that my son had that wisdom. I said, oh my goodness, thank goodness.
Well, I'm seeing that some people are mentioning that on the chat list too. It's important to recognize, and I think that we do need, I think Shirley is saying, I don't know if we could pull that one up, that she says with the diagnosis of cancer, there's it would be a great automatic support system to have in place. And that is incredibly important to me, because I feel like I'm probably outside of the realm of what most people believe, but I'm sure that as a matter of fact. But I think that emotional health has to be the foundation for any kind of medical treatment. The emotional, spiritual healing has to be there first before the treatment is going to do any good. So that's why the counseling, talking to people, understanding how important it is to get to a base level of very low stress, so that the treatments will be helpful, so that the things will be less, the side effects won't be nearly as painful, or as I want to say there's a difference between pain and suffering, but as anxious producing. So the emotional support has been downplayed, and that's what we absolutely need, more emotional and spiritual support.
Yeah, it surprised the heck out of me, and continues to surprise me, that everything is focused in on the medical side of things. Yeah. And if the patient is having an emotional roller coaster, the answer is a prescription. See the psychologist, see the social worker. Yeah. And when you get there, they really don't have answers, because the answers are coming internally from the patient, and they have to be at a stage of readiness to actually work with that. And those social workers and psychologists and professionals can't put you into daily or weekly visitation. It's crisis management is essentially what they fit in. It's much like the medical profession. You're bleeding, we've got to put a tourniquet on it and stop the bleeding. So, oh, you're crying, you can't sleep, you're stressed out. Okay, we may have to give you drugs, but maybe we'll have to give you cognitive behavioral therapy. Maybe we'll have to do some other things. So go to the social workers, and they try to come up with this remedy. And yet, it's not really that. I mean, I think the message that I wanted to bring out on today's session was, if the medical profession, the caregivers, and the patient started focusing in on what is the patient really feeling. It only happened when I started to ask myself, what, because people would say, so how are you feeling today? People would visit me or whatever, and I, oh, fine, good day, bad. That was the extent of it. And yet there was a huge amount of information. I mean, the biggest wish I had two biggest wishes. One, I really wanted a hug. I really wanted to feel close to someone. And because, I didn't have a significant other in my life, my close friends could give me, a brotherly hug, or what I call grandma A-frame hugs, but they weren't relaxing me in any session, in any way. And the other thing was, I wanted to sit down with someone to help me organize my thoughts. And as you said, when you met me, I had just been fortunate to start to have a weekly meeting with a social worker who came into my life, visited me every Wednesday with a cup of coffee, and allowed me to ventilate, get things out. And in fact, even on my first anniversary of the surgery, I couldn't believe it. It was like this emotional upheaval, and I had no idea why, because I had reached a state of calm and generally in my life, and yet the anniversary date of the surgery came up, and I was a basket case again. It was amazing how the emotions came up, and there was my a professional aide who was now my personal friend. It had developed into a friendship. That was able to help me just ventilate, be there, and let me do it, and not judge me, not try to give me, expertise, but rather just helping me organize my thoughts in a very clever way. And that was an amazing thing that I wish that people would do that. As is on the screen now, the focus is to bring out to patients and caregivers that there's a lot of other kinds of information that are not psychology, that are not sociology, that are not psychosocial, that are not medical, that if you could wrap around the educational program when it begins, when they say, you've got cancer, and you go into shock, as part of the next stage is, hey, let's prepare you for a journey. Absolutely. If you were saying, let's go to Antarctica, I mean, you would ask, how? What am I going to do? What would I dress? What is it going to be like? Get me ready for this journey. With cancer is, oh, sit back, Dave. We'll look after you. We need to look after you medically. And I have to say publicly, my medical team saved my life. I mean, I had 3 occasions that I almost died, and they were there. I mean, and it's amazing to be beholden to someone who physically saved your life, but they didn't help me with my headspace, which was killing me until it started to get into the recovery phase, the healing phase, and finding a new normal once again, where we had a new normal of who was Dave during the 18 months of treatment. Now, who was Dave as he went from patient to person? And as Dr. Ann Katz talks about, that journey moving into survivorship is as difficult and as long-lasting as the journey from the beginning of cancer till you're treated. There's a lot going on that doesn't seem to be talked about, and hopefully that's what this series on coping with cancer is all about. And as the audience knows, you and I can go on talking about this thing for hours. And we just
but we're not going to put them through that today.
No. What we want is just to interact with the audience with some of these questions that they have.
And I have to say that I see a lot of people are mentioning about the medical community, and I've come from some training in mind-body medicine where we're working a lot on stress management, and it was founded by a psychiatrist 30 years ago. So I think it's in 14 medical schools around the country. So they are making slow progress into training physicians in the medical school system about this connection between the mind and the body and how important emotional and spiritual health is in the healing process. So it's on the way. Unfortunately, it's not in standard care right now. And so now we have things like this wonderful opportunity for us to get together and chat about it, or chat after the webcast and just support each other, because I've got some wonderful things to share from my experiences. Everybody here has their own perspective and what works for them, so it's a wonderful, wonderful forum. I'm so excited to be here.
Yeah, the one of the phrase words I picked up was I needed a lifeline. And one of the benefits, by purely accident, I met a group in Denver called mylifeline.org, and they are one of the special people in my life, because without mylifeline.org, I wouldn't have been able to cope well with all the things that I was dealing with. And quite simply, and I advise anyone who knows a cancer patient to have them jump over to mylifeline.org and take a look at the service, which appears on the surface to be a blogging tool. And they say, well, I can blog and do it. But it's not that way at all. In fact, when you start to use their tool, it becomes a communication tool. It was quite strange for me when I was diagnosed that I only had 2 or 3 people that I would consider caregivers, support people around me. And by the end of the journey, I had about 35 people. And at the beginning of the journey, I was just trying to keep everyone in touch by, email. Here's what's happening, here's what's going on, and so forth. Very cursory. It's sort of the answer of, well, how is Dave today? And I would say something. When I found my lifeline, it became quite different. This concept that I talked about earlier about ventilation was what my lifeline became for me, because I was able now to this group of people that instead of sending a cursory email, went to the doctor, here's what happened, I could express how I was feeling, and it wasn't just a matter of typing. I would write 2 or 3 paragraphs of the journey of the day, and then I would read it back to myself and was astounded how negative or how sad or depressing it was. And I said, oh, I can't tell everyone this. And I would go back and edit it and start to rewrite so that I could get my thoughts in order, get some concept. Well, it wasn't really as bad as I thought it was, because really it's this. And I was then able to add a little sense of humor so that everybody who was following me knew exactly how serious the situation was. Right. But I had a chance of doing this 3 or 4 times, and then people would comment back to me when it was published with supportive comments, which I could then respond to, that helped me interact and understand what was I really feeling and what did I want other people to know. It is a remarkable lifeline. It really was a lifeline. Now, they have some practical things. They have a calendaring system that saved my life a number of times, where you'd say, hey, I need someone to help me wash my dishes. I need some food. I need some help to get to the doctor's office. That practical side is there as well, but the communication format that's there. And I think it's just so important that people know that there are support tools that if a caregiver knew about, they could introduce into this cancer journey and help the person move along in a better way than just a school of hard knocks. Every day it's another intervention. Every day it's another moment of stress and anxiety. No one knows what to do with it, and it becomes totally overwhelming. And added to that, to the fear and the anger and the depression and the hopelessness, how in the world do you generate strength? How do you develop perseverance? How do you generate courage? I mean, it's it's a life-changing event, as they say, and not in the trite way. Every cancer patient I've met up till now has gone through this to some degree and recreates a new identity for themselves as they either handle these things well or moderately or not at all. And at the end, when they move into survivorship, they are different kinds of people, and that's why I call this Find Your New Normal. You've got to find a new place. But, you know, as I said 5 minutes ago we would stop. But here we are, another 5 minutes, so we should stop now because people have to leave. And what I will invite is there's a couple of people here who came in from Google, and so they have cameras that we can turn on. We'll carry on the conversation after I turn the broadcast off. And for those of you that have had comments,
that's a good one, Dave. Let's talk about how soon we're going to come back for everybody.
Well, that's the whole idea, is that based on the comments that we have and the fact that people actually showed up,
nice.
There is a place on Find Your New Normal called Ask Dave, and if you could leave a comment over there about how you felt the show was and what you felt it was all about for you. I'd like to do it certainly again in a couple of weeks as we come together with an extension of this topic, because it's always going to be on how to cope with cancer. Some of the sessions I envision getting into the actual mechanical tools that patients are shown and how to effectively employ them so that the transition to those tools are a little easier. But we'll have, you know, it's a conversational format, and I will go back to all the chat that we have and answer what's there, and the replay will be sent out to everybody and a link what we've got available. And I'd like to just do this as often as we can get an audience together. What do you think, Sheila?
I think I'm in. I'm ready. This is my passion. So this is exciting, and you know, I help a lot of people with stress and with adapting to all kinds of loss, whether it's your health or, you know, relationships or financial. But I'm always drawn back to the healthcare community. It's where I started my career 30 years ago, and I have, you know, it keeps sneaking back in. So I am so thrilled to be a part of this and look forward to future shows.
This is super and a good place to stop. Let me thank you for all your words of wisdom. I think that was a nice conversation, like we usually do, except they go on for 4 hours when you and I get together. To cut this off, you know, in 40 minutes is amazing. And for everyone out in the audience, send a comment and thank Michael Daniels. I mean, he was there quiet in the background, wrangling the comments and making sure the technology didn't fail on us on our inaugural launch. So thank you very much, Michael. I really appreciate your help and your friendship and all the support you've given me as I've tried to take this dream that I've had for a couple of years, actually launching it. So let's stop there. Thank everyone for attending. Watch the emails so that you can see when our next session is. I am posting other kinds of videos on Find Your New Normal. So go over there and register so that you see the other things that I want to do on helping people move through this journey of cancer. But thank you all for attending, and I'll shut off the live broadcast. But stay in the room for those of you that have cameras that want to stay and talk. So thanks very much all. I really appreciate it. You have no idea how important today was, and I really am grateful to all of you for coming. This was a super special moment. Thank you.